Welcome to Docplexus News. On one hand, government is citing shortage of doctors, but on the other hand, 6 states, namely Delhi, Karnataka, Kerala, Tamil Nadu, Punjab and Goa have more doctors than the WHO norm of 1:1,000 people. Majority of doctors in these states are unwilling to move to states suffering doctor crunch. So ultimately, the question that arises is whether merely producing more doctors is addressing the shortage issue in public health and rural areas. The Union Health Ministry has drafted rules for e-pharmacies to regulate the online sale of medicines across India. The decision has been taken to ensure accessibility and availability of genuine drugs from authentic online portals to the patients. According to the regulations, any person who intends to conduct business of e-pharmacy shall apply for the grant of registration to the Central Licensing Authority through the online portal of the central government. The Ayushman Bharat Jan Arogya Yojana will be launched on September 28 in Uttar Pradesh, benefiting 1.18 crore families of the state. The health minister said that the treatment of 1,350 diseases along with medical tests including X-ray, MRI and ultrasound will be covered under this scheme. The scheme will also entitle the treatment of serious ailments like heart attack and cancer. Researchers at Cleveland Clinic, University of Oxford and University of Erlangen have discovered a novel imaging biomarker which can predict cardiac mortality by measuring the inflammation of fatty tissues. They have developed the perivascular fat attenuation index as an imaging biomarker to quantify inflammation. This new technology may be useful in preventing and detecting patients at risk for future fatal heart attack. A study published in the journal Circulation demonstrated that Apixaban is a safer choice than Warfarin to prevent stroke in patients with dialysis-dependent end-stage kidney disease and atrial fibrillation. The study also found that patients on standard dosage of Apixaban of 5 mg twice daily had lower rates of stroke and death compared with those on a 2.5 mg twice daily dosage. WHO's new guideline supports the use of low-cost second and third-line medications for type 2 diabetes. It also promotes the use of human insulin for controlling blood glucose level in diabetic patients. This new guideline reviewed the newer diabetes medicines and concluded that these medications are more expensive and their benefits are based on weak evidence. According to a study published in the journal The Lancet, over 16 lakh people in India die every year as a result of poor quality of healthcare. The main reason for the loss of life is the insufficiency of primary and hospital healthcare facilities. The study reported 84% cardiovascular deaths, 81% vaccine preventable diseases and more than 60% neonatal complications due to the substandard medical care. The Goa state government is all set to launch a diabetic care program on 20th September. The program aims to map the diabetic population through a registry and provide them with free insulin. The health minister said that training will be provided to the staff which will enable them to run food clinics at primary health centers, sub-district hospitals and the Goa Medical College. Nowadays, concussions have become a significant public health concern. Every year, more than 8 lakh children seek treatment for concussions. For the first time, CDC has issued guidelines on treating concussions in children. These guidelines provide knowledge and tools to the doctors which are needed for the best outcomes in mild traumatic brain injury patients. From these guidelines, the Public Health Agency has highlighted 5 key practice-changing recommendations such as avoiding routine imaging in pediatrics for mild traumatic brain injury, using age-related symptoms for diagnosis, considering patients' personal characteristics and family, instructing the caregivers on customized returning to activity, counseling parents and patients to return gradually to non-sports activities after proper rest. Share your feedback on these guidelines by commenting below. These were the latest happenings in the medical field brought to you by Docplexus, one of the largest online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!